morning, the Board of Directors and CEO. Today we are going to describe 5 topics which relate to indigenous people's health and well-being. I'm going to introduce myself and each of our group members and their topics as well. My name is Teresa. My topics are based on the NSB202, the barriers that for meeting the holistic care needs of indigenous people. And this is Anu. He's going to discuss the stress of original community-controlled health service, and this is Donna. She is going to discuss the role of indigenous health worker, and this is Cynthia. She is going to discuss the common health system factors that contribute to indigenous people's risk of discharge against medical advice. And this is Bimao. She is going to discuss the political imperative of well-being. Okay, let's start first. According to the NACCHO, the definition of indigenous people's health means not only physical but also social, emotional, and cultural as well. To begin with, substance-based in indigenous Australia has a negative impact on physical. There is evidence to show the leading cause of death for indigenous people is heart disease. The major risk for this disease is smoking. In addition, the social and emotional well-being can be affected by education, employment, income, and housing. The link between these are well documented. The higher person's education achievement, the more likely they are to be employment, and the more highly paid the job is like to be. The indigenous in Australia tends to leave school at the younger age. The standard of a person's housing and their health are linked. For example, overcrowded conditions can promote cross-infection. Furthermore, there are significant potential barriers for cultural safety, such as imbalanced power, right privilege, trust relationship. To sum up, the factors that to be the barriers such as substance abuse, education, income, and so on. Thank you. I'm going to pass to Anil.
Thank you, Teresa. My name is Anil, and I'm talking about Aboriginal community-controlled health services. They are a vital part of Australian healthcare system. It started in 1971 in Redfern, New South Wales, and at present there are more than 150 ACCHS providing services to indigenous people and adding value to mainstream health system. ACCHS has successfully contributed in improving the health of indigenous people, resulting in their psychological well-being and reduced hospitalization. It has also reduced the health inequality between indigenous and non-indigenous people. ACCHS has also addressed the social determinants of health by providing employment and educational opportunities to indigenous people. It has also helped non-indigenous health professionals in increasing their understanding of culturally appropriate care for indigenous people. As a primary health care provider, ACCHS is playing a leading role in improving indigenous people's health by increasing access and delivering a comprehensive primary health care. Indigenous people prefer ACCHS due to its flexible, responsive, and culturally appropriate care, which is delivered by indigenous staff in a safe environment. According to NACO, more than 50% indigenous people use health services delivered by ACCHS, and it is also the largest private employer for Aboriginal and Torres Islander people. As there is still a gap between indigenous and non-indigenous people's health, ACCHS can provide key contribution in improving the health outcomes of indigenous people. Mainstream health services should consider the role of ACCHS in their health policy programs and funding decisions to make ACCHS effective in addressing the direct health needs of indigenous people. Thank you. Now I will pass on to the next speaker.
Thank you, Neil. So Aboriginal and Torres Strait Islander healthcare workers can be imperative to the team, especially with the increasing number of Indigenous patients at risk of developing deadly diseases. It is crucial for Indigenous patients to feel comfortable and to be cared for as required, with the rates of discharge against medical advice so high. Aboriginal and Torres Strait Islander healthcare workers can undoubtedly provide a better quality of care to Indigenous patients rather than a non-Indigenous nurse. Indigenous patients may feel overwhelmed, intimidated, or disempowered in an unfamiliar environment, so it can be comforting to see a familiar face. Also, with the wealth of knowledge and language passed down, patients can have an Indigenous healthcare worker translate or interpret to correctly relay their message to other healthcare professionals rather than waiting for a professional interpreter. Although having an Indigenous healthcare worker translate or interpret can be a limitation because they may find it difficult or frustrating to work in such an environment, as they cannot maintain a good time management plan and continually must help others rather than focusing on their own responsibilities. Although this can be overcome if the nurses and Indigenous healthcare workers can work collaboratively and continuously support each other. Yet if they have different roles, it may be difficult, so if the patient can wait, it's better to contact an accredited translator or interpreter service. Also, with Indigenous healthcare worker not working, this can cause the patient to become anxious or frustrated, so it will be important for the non-Indigenous healthcare worker to build a therapeutic relationship. In conclusion, nurses and Aboriginal Torres Strait Islander healthcare workers can optimise each other's roles, as they can work collaboratively to provide a better quality of care to Indigenous patients. Having an Indigenous healthcare worker can be a great advantage to the team and can provide support and knowledge that others cannot possess. Thank you.
Thank you, Doma. Hi, I'm Cynthia. My topic today is to talk about the issue of discharge against medical advice. Some research show that Indigenous people have approximately 6 times more of self-discharge than non-Indigenous Australians. This research has also examined that pain-related condition is the most common diagnosis among self-discharge groups. So, once they feel no pain, they may not obey the treatment plans and leave without permission. In particular, for those who face English as their second language, miscommunication can be seen as a barrier to deliver health care for Indigenous patients with treatable diseases. Because of that, they could not follow the treatment plans and prefer leaving when they feel better. In addition, the few resources of primary care services and the lack of proper aftercare health facilities may contribute to the worst outcome of self-discharge among Indigenous people. To address these concerns, developing the local health professionals for a culturally appropriate manner, providing cross-cultural training or education is also an essential strategy to deal with the problem of miscommunication. This is not only beneficial for Aboriginal societies, but also maintain the nurse-patient therapeutic relationship positively. In addition to that, it is significant to develop additional community-based facilities to provide appropriate primary or aftercares for Indigenous patients, especially in the rural or remote area. This is the end of my presentation. Thank you. Now I would like to hand over to the next speaker.
Thank you, Cynthia. My topic of political imperative of health well-being. How nurse can be better patient advocate for Aboriginal and Torres Strait Islander people. As a nurse, being a patient advocate for Aboriginal and Torres Strait Islander patient means to defend the rights of and be a supporting voice for the Indigenous patients. In context to Indigenous health, patient advocacy can be represented in 2 ways. Firstly, by actively participating in Indigenous patient care by supporting their rights, communicating their healthcare needs to the medical team, and providing information to the patient to assist them making their own decisions. Secondly, by involving in broader efforts to improve the healthcare environment and safety standards and the quality of care for Aboriginal and Torres Strait Islander patients. For Indigenous patients, there is a lack of patient advocacy who understand their healthcare needs and concern and issues they are facing in various healthcare settings. Inadequate patient advocacy arises when most nurses are less aware regarding their own rights and the patient rights as well. Nurses should actively participating in making of policies and procedures involving the healthcare plans for Aboriginal and Torres Strait Islander patients and need to be updated regarding the healthcare and nursing issues in their area and around the country. Nurses can act as patient advocate to save the Indigenous people from any biased behavior and structural racism occurring in the healthcare settings. Nurses are in position to ask questions related to any action responsible for health disparities of Aboriginal and Torres Strait Islander patients. In brief, nurses' role as a patient advocate will benefit both Aboriginal and Torres Strait Islander patients and the government initiative to provide Indigenous people a disparity-free healthcare system. Now I would like to thank you, the Board of Directors and the CEO, on the behalf of my whole team. Thanks.
Thank you.
Thank you.